urethra much shorter than the male. This is one of their big complaints about having to pass stones. Their urethra is somewhere between 9 and 12 inches long. And so you'll find that, I'm sorry, yeah, 9 and 12 inches, 9 and 12 centimeters long. And so you'll find that they cry about the amount of distance that stone has to traverse and the amount of damage that can be done. We will talk about the internal urethral sphincter and the external urethral sphincter with the reproductive system. There you see the bladder, and look, that's the bladder. This right here, uterus, this bladder. As this begins to extend and expand out in an anterior direction, and you're carrying that little turkey with you, and it could be anywhere from 25 to 45 pounds of fluid that they're carrying. Puts a lot of pressurization on that bladder, right? So number one, you'll have to go on a regular basis. But number two, we're concerned about the distension and the damage to the muscles that occurs from the amount and the weight of the fluid that's there, okay? There's the urethra, and again, we will talk about the tract of the pathway for the male when we get into the reproductive system. Real quickly with urinary tract infections. Urinary tract infections, and when we talk about a urinary tract infection, we're generally talking about an infection somewhere either in the ureters, the bladder, or the urethra. Again, if we're seeing infection in the kidney, excuse me, we're highly concerned because it probably has been deposited there by something that has come in from the blood source internally, so sepsis. Make sure you know the clinical term cystitis. It is an infection of the bladder, very common in females because of the short urethra. If not controlled and if the system is not in good working order, you might find that there is some pyelitis, which is an infection of the pelvis. What we never want to see is what's called pyelonephritis, which is an infection that actually can reach the cortex and the nephrons. And this, again, is not going to be retrograding from the exterior up to the central portion of the kidney. This is a result of a blood-borne bacterial infection that is delivered through the afferent arteriole into the glomerulus and probably has heavily damaged the glomerulus and the rest of the nephron that's there, okay? The act of voiding urine, we've already talked about. Again, the detrusor muscle will actually go through that relaxation. The trigone will trigger, and there'll be a S to I, superior to inferior, and a posterior to anterior push of that fluid. Parasympathetic activity is taking care of that. Make sure you know the term micturition. Micturition, that is the clinical term for urination. I know your patient will talk about peeing, and your provider might talk about urination. But micturition is the correct clinical term to initiate the act of urination and to void out that liquid material that's there, okay? This is what it looks like. And again, we talked about this. As the urinary bladder gets full, the stretch receptors that are found in the wall feed a negative feedback loop or send a negative feedback loop to the brain in the pons, sending a response back to allow for, number one, the relaxation of this muscle and the initiation, the relaxation of the detrusor and the triggering of the trigone muscle. Okay. Please make sure you know what a Valsalva movement is. Valsalva maneuver is the act of bearing down and causing a pressurization from S to I to release, number one, fluids from the urinary system, waste from the digestive system, but it also may involve the delivery of the fetus. Okay, so that push that is created to create downward force, gravitational force, is called the Valsalva maneuver. Last of these is called hemodialysis. And you'll find a lot of your patients are participating in hemodialysis because their kidneys are no longer functioning correctly. Hemodialysis is key in the cleaning of the blood product. Again, nitrogenous waste cannot be eliminated in any other way than to be voided out through the urinary system. Therefore, if the urinary system and the kidney is not working correctly, we will need to eliminate that waste through that hemodialysis. So, number one, removal of nitrogenous waste. Number two, the regulation of blood pressure. As the kidney reabsorbs water, that water and the volume of water is the number one indicator for the blood pressuring system. And if we are not removing the waste and recycling the water, there's no way for us to control that blood pressuring system. Okay. Causes of nephron destruction: hypertension, increased blood pressure. Too much pressure being delivered to that afferent arteriole will tear that glomerulus. Kidney infections, trauma, prolonged ischemia, hypoxia, heavy metals, or solvent-based materials. Nephrons can regenerate and restore the kidney. However, it is only on a short-term process. And if you continue to have to repair them on a short-term process, eventually they can't hold up in the long-term process and they will fail. Okay? You can survive with just 1/3 of one kidney. Once we lose 75% of those nephrons, we are unable to maintain the homeostasis, causing azotemia, acidosis, uremia, and again, hemodialysis will be the next step in that process.